So I understand here at St. Bernard's we have mental health services through several places. We have mental health services through St. Bernard's Counseling Center, behavioral health, the crisis stabilization unit, and mobile assessment there in ER. So can y'all tell me the differences and like the difference of the departments and explain a little bit different about the different departments?
Well, with the Crisis Stabilization Unit, it is one of our newest ventures, I think, for behavioral health, and we provide acute care services, such short-term services. What we do with the Stabilization Unit is if someone needs like immediate medication changes, they need immediate therapy, they need linked to outpatient services, they can come there. Our inpatient behavioral health unit is very similar, although it serves clients that have a higher need. And when I say a higher need, I mean they may be having suicidal thoughts, they may be experiencing psychosis, something that requires a little bit more care and attention while they're with us.
Yeah, the biggest difference between St. Bernard's behavioral health inpatient and St. Bernard's crisis stabilization unit is that people that are at behavioral health inpatient, they can't be safe anywhere else. They can't be safe at home because they're having immediate thoughts of danger to self or others. And so all the risks there are mitigated. We have 24-hour staff, they see a psychiatrist, they have group therapies, things like that. It's more intensive services. And then crisis stabilization is a place where you could go to check in if, say, you're feeling overwhelmed or you just don't feel like being alone because you're very stressed and you're having thoughts that are upsetting to you, but you don't necessarily have a plan. You just want some help. And so that would be more appropriate for the crisis stabilization unit. And also, crisis stabilization is all voluntary, so you could leave at any time. And then St. Bernard's Counseling Center is less intensive services. It's outpatient counseling only. We have medication management with psychiatric APRNs, Dr. Tran, and Dr. Cannon. And then we have therapists that cover a broad range of therapy services, including EMDR, which is used for trauma therapy. We also have play therapists that work with children. We have a perinatal therapist that works for women that are postpartum or pregnant. We have a psychiatric APRN that works with children. We have transcranial magnetic stimulation, which is a treatment for treatment-resistant depression. It's a machine that it uses magnets to stimulate neurons in your brain to help decrease depression. That's for people that have been on antidepressant medication before and they failed. And it takes 6 weeks of treatment. They come five times a week for 6 weeks. And it doesn't hurt. You can drive yourself there. You can drive yourself home. It's non-invasive. And we've seen really positive results from that. We've also developed started a new program called Spravato. It's esketamine nasal spray, and it's also for treatment-resistant depression. That is a little bit more intensive than the TMS because you're there for 2 hours twice a week, and you cannot drive yourself home once you're there. You stay at the facility or at the agency for 2 hours post-treatment for monitoring, and then you go home. So we're really excited about these two new programs that we have, but it's all outpatient for the St. Bernard's Counseling Center. TMS and Spravato, they're all relatively new. So what we do is when someone's interested in either one of those services, we do benefits investigations. So we would contact your insurance company, run your benefits, and see if it's covered. If it's not covered and it's still a treatment that you'd like to consider, we do have charitable assistance funds through St. Bernard's, and we could help you fill out a packet for that.